Good morning. Hi. This is Dr. John McGarry. I'm an orthopedic surgeon at Plano Orthopedics and Sports Medicine, and I focus in the sports medicine department on shoulders and knees. Today we're going to be talking about a case of a 29-year-old gentleman who is having shoulder pain. This gentleman is 29 years old. He is healthy, has no medical problems, and he presented to me with severe pain in his shoulder that was limiting him in his weightlifting. This gentleman was a power lifter, and for a few months he was having significant pain with any of the pressing motions, overhead or bench press. He presented to me wanting some relief and wanting to get back to his hobby of lifting weights. So when I saw him, I got, like everyone, I get a set of x-rays and an examination. On examination, the patient was extremely tender over his acromioclavicular joint on top of the shoulder, and he also had a little bit of pain with overhead activities and arc of motion of the shoulder, which is rotation of the shoulder. So I diagnosed him with impingement, and with the help of the x-rays, I diagnosed him with something we call distal clavicle osteolysis, which is just a little bit of an irritation of the AC joint where the end of the clavicle starts getting inflammation and cystic changes in the end of the clavicle. And on the x-rays, right at the end of the clavicle, you can actually see some of the cysts in the bone, and on certain other views you can see what we call a moth-eaten appearance of the bone. So this was his source of pain. So the first thing that I did was explain it to him, what was going on, and discussed conservative treatment. So we tried an anti-inflammatory and rest from lifting and some physical therapy. He also had some evidence of impingement or some inflammation on top of the rotator cuff. He did his therapy, he did his anti-inflammatory, but returned with continued pain and the inability to do any bench press or overhead activities. So my next step was to do a steroid injection directly into the AC joint, where we come straight down into the joint and inject a little bit of medicine, which consists of an anesthetic and a steroid. This usually has a pretty quick onset of action of a day or 1 to 3 days, and the patient then was returned to me in about 6 weeks. When he returned, he said that the injection helped for about 2 weeks and then started to wear off and the pain returned. So at that point, I went ahead and sent him for an MRI to see if there's any other pathology that we were missing and if the distal clavicle indeed showed up inflammation. So when he returned with the MRI, his rotator cuff was intact. There was no other pathology in the shoulder other than the distal clavicle changes, as well as some bursitis and some inflammation in the shoulder. So we counseled him, and we talked about surgery and what could be done. After discussing the surgery, he elected to go and move forward with the surgery, where I went into the shoulder, explored all the structures in the shoulder, and then I removed a little bit of the distal clavicle and a little bit of the undersurface of the acromion and the bursa. So once we did the surgery, it was about, I actually saw the patient today for his 6-week follow-up. He's much happier, much better. Still has a little bit of inflammation, but no pain anymore. A little bit of stiffness in the shoulder. He's back in the gym, getting better every day. So when he came back after his first post-op visit, we did get some x-rays. And as you can see, if you compare them to before, we've removed about 8 to 9 millimeters of the distal clavicle, and we've removed the area of the clavicle that was inflamed, had the cystic changes, and also just removed just a little bit of the bone underneath the acromion. So that is what we call a distal clavicle resection and also an acromioplasty. No, nothing is removed. No, nothing is replaced once we remove it. The body will fill that area with some scar tissue. Once this surgery is done, it is a day surgery. It takes about 30 minutes to do this surgery. They go home. They usually follow up with me in a few days. We usually take any little stitches out in about 2 weeks. This is usually done through usually 2, maybe 3 little stab incisions in the shoulder. A sling is used for comfort for a couple of weeks, but then they discontinue the sling and its activities is tolerated. Physical therapy is expected to be done to help with the range of motion. And once they hit about 6 to 8 weeks, they can return to activities as tolerated, and they're usually back to doing all activities pain-free at about 3 or 4 months. So this is the conclusion of this case. So if you have any questions or comments, you can please leave those in the comments section. And if you ever have any other topics of the shoulder or the knee you'd like me to discuss, you can also leave those in the comments section. Once again, thanks for joining us today. I'm Dr. John McGarry at Plano Orthopedics and Sports Medicine.